Yep,
should be
it
all
says
set.
recording. Yep, great. Okay. So let's start with staff. Stephen I don't think you were here the last time we met in June. So why don't I turn it over to you to introduce yourself? And I know, obviously you're newer to the team, and we have Robbie, and then I think Emmett is also you may want to introduce Emmett as part of the data team.
Okay. Nice to meet all of you. Stephen Andrews. I've taken over from Kate O'Neill. It's very big shoes to fill. She did an incredible job with the handover, getting me set up to be successful, being well documented and stuff. So trying to continue a lot of the stuff that she had started. It's been 4 months now, and we've gained a few more people since I started. So the team is actually relatively young at this point in terms of tenure. Robbie, why don't you go ahead and introduce yourself?
Yep. Thank you, Steve. Hello, everyone. This is Ravi Lala. I'm the new Director of Data Management Analysis and Data Integrity. Just like Steve mentioned, I'm one of the newbies, on the team, have been here for four months and, have been enjoying thoroughly. Thank you.
And Emmett?
Hi, everyone. My name is Emmett. I've been here 3 months as of yesterday. I'm the new data and reporting coordinator working on the A team. I'm also really excited to be here.
Thank you, Robbie and Emmett. Quick question. One of the things about being new here is I'm also new to MS Teams. Is everybody seeing the agenda that I'm trying to share?
Yes.
Okay,
Yeah.
Thank you. So I'll turn it back over to you, Susan.
Thank you, Stephen. And it is exciting. We've got some great new folks on our team. I will also announce that Kate O'Neill, who is on our Data Governance Council, moved into a different role at the Green Mountain Care Board. I hope I can get this title right. She is, I'm going to get it close. I'm notoriously bad with titles. Director of Prescription Drug Oversight for the Green Mountain Care Board. Close, Kate?
It is close. I like that title better, actually. It's technically the Director of Prescription Drug Pricing.
Oh, okay. Maybe we can look into that. Thank you. And so, Kate, last year in the legislature, a law was passed for the Green Mountain Care Board to investigate and assess and evaluate different types of oversight of prescription drugs. So she is leading that work. So thank you, Kate. So let's see. Let me, before we get to our new board member on the council, I want to talk about really high level what the Green Mountain Care Board has done since June, which before I started this meeting, I was like, oh gosh, are we going to be here for the next 45 minutes? But on a very high level, the Green Mountain Care Board has a very busy summer regulating both hospital budgets and insurance rate review, insurance rates for the exchange plans. And we did both of those this summer. On top of that, we were in a full-fledged community engagement process for Act 167, where we, with our contractor, we're out meeting with every community, all 14 hospital service areas, and interacting with folks on the ground in their communities. A very robust process. And in the fall, in September, our contractor released the Act 167 report that can be found on our website. Where we are today is the Agency of Human Services, through statute, has the role of leading the transformation process for communities and hospitals in order to sustain in this pretty, challenging landscape. So stay tuned on that. They have some great information and updates on their website. I'd encourage folks to check that out. We are here today. We have, as I said, a very robust agenda. I want to approve the minutes first, and then I'm going to move to new members on the council. So, or I want to ask for approval. I shouldn't say I would approve. So let's go to the approval of the June meeting minutes. If folks have had a chance to look at those, I have. Can I have a motion?
So moved.
Thank you, Larry. In a second.
A second.
Great. All those in favor to approve the June meeting minutes, say aye.
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 Great. So the next item on the agenda is new council member designation. Per the GMCB data governance charter, the voting, there is a voting council member from the board that this member from the Green Mountain Care Board will have membership on the council, and in their role, it's really to provide the perspective of the board, the Green Mountain Care Board, and to communicate with other board members about the work of the Data Governance Council. So previously, Jessica Holmes was our board member on the Data Governance Council. She is moving on from this role and as a member of the Data Governance Council, and I'm nominating, or I'm putting forth, because we technically don't have to have a vote on council membership, but I want to put forth Tom Walsh as the Green Mountain Care Board member for the council. So Tom is here, and I think, Tom, it would be great if you would introduce yourself and tell us a little bit about your background and why you're interested in this role. And then I also saw Josiah was on as well. And I know, Josiah, you were most recently appointed to this role. So maybe after Tom goes, if you could just introduce yourself and tell us a little more about yourself, that would be great. So Tom, take it away.
Thank you, Susan, and I apologize for my voice. I'm getting over a cold, and my voice is lagging my recovery. I'm happy to be nominated for the role. Part of my prior career before joining the Green Mountain Care Board, I was very interested in outcomes research for healthcare and evidence-based medicine, and then evidence-based policy. And in order to have an evidence base, you need data. And so I've been paying attention to data, how we can use it better. What are the limitations to our current situation with data? How can we fill those gaps? Those types of concerns have been an interest of mine for the past 30 years. So when this spot opened, I was interested in stepping in if you'll have me. So thank you for your consideration.
Thank you, Tom. I hope you're feeling better. I know we have a couple of other folks fighting cold, so you're better soon. And thank you for that great introduction. And I am very excited to have you join the council. As I said, we don't have to take a vote, but I think it might be helpful if we did take a vote. So why don't I just move to add Tom Walsh as the Green Mountain Care Board member on the Data Governance Council. And do I have a second?
A second.
Okay. Any discussion? I'll put Tom on the hot seat a little bit.
I would like to jump in, if
Sure.
I may, Susan.
Yeah, please.
Tom, as you probably know, I staffed the Data Governance Council for many years, but last year was appointed into a seat, and but from both perspectives. I just want to say welcome, a hearty welcome from me. I'm so happy that you're willing to participate on the council. It's always rich and robust. It's very data centric, and your thoughtful approach is, I think, going to be just it's just going to make this council all the better.
Thank you, Kate.
Anyone else? Okay. So all those in favor say aye.
Aye.
Great. Welcome, Tom. Thank you.
Thank you.
So now I want to turn it over to Josiah. If you would just introduce yourself, because I know we added you to the council, I think in June, but I don't think you were here. So I'm excited to have you here. And if you could just, like Tom, introduce yourself and share what you're hoping to help us with on the council.
Sure. So yeah, I'm Josiah Raish. I'm the state's chief data and AI officer. Been with the state about 8 years in various technical roles. I'm within the Agency of Digital Services, and have already been working with Green Mountain Care Board a fair bit, supporting Stacy, who's kind of your technical point of contact, and I think the work. As I was reviewing like the requests coming through, data sharing requests, things like that. One of the pieces that my team is working on standing up for the whole state is a data privacy office. And so finding ways to support the resiliency and the capabilities of our data governance processes while protecting Vermonters' personal information is something that I care a lot about and I think a lot about. And so I think I'm excited to be here.
Well, we're excited to have you. So thank you. And yes, I would be amiss if I didn't recognize your work with us at the Green Mountain Care Board as we steward our data sets, the VUDs as well as VCures. So thank you. So let's see. The next item on the agenda is data linkage request. And this is the UVM Larner College of Medicine. And is this, Stephen, is this you or Ravi who's going to set this up, or do I just invite the UVM Larner College of Medicine folks to start in?
I think Ravi was going to introduce this.
Perfect.
So I'll turn it over to Ravi.
Yeah, thank you. Thank you, Susan and Steve. I think, like Patrick from UVM, like is in attendance, like on this meeting, to talk about the research. So essentially, the data linkage request was submitted, like under the existing DUA with UVM. It is active, and like this data request is, like under that DUA. So, Patrick, if you're on the call, would you like to present your research?
Yeah, I'd be happy to. So I'm Patrick Payne. I am the data analyst on the project, and Chelsea Turley is also here from UVM, and she's kind of our point person for VCures in general. But one of the pain physicians, Alyssa Zhu, and I have been working on a project to look at utilization of interventional pain services within the geriatric population of Vermonters and compare it to non-geriatric Vermonters. The origin of this project is that patients over the age of 65 are most likely to have low back pain and pain in general, but the treatments that are used by this group of people are largely understudied, with the literature only containing a few publications, maybe 3 or 4, that specify the utilization of these services within that population. And ultimately, this leads to a lack of treatment recommendations from the societies within interventional pain and pain management in general. The thought is that with Vermont being a growing aging population, that having care recommendations that are specific to the aging population would not only better suit Vermont, but would make a substantial contribution to the overall body of literature within interventional pain and pain services. So currently, we've done our analysis, assuming that all of the patients within the claims database have survived the extent of the 3-year study period. But unfortunately, that is not necessarily the case, and we'll need to link the claims data with the vital statistics to know what patients experience mortality during that time period, so we can censor the data appropriately and capture the correct utilizations for interventional pain during the 3-year time period, or 2016, 2016, 2017, 2018, and 2019, so 4 years that we already have from features. So that's kind of an overview and a sense of what the intended impacts of the study would be, but I'm happy to answer any other questions.
That's great. And Patrick, you don't have any slides. I was actually, if you don't have slides, which is fine, I was going to ask Stephen to maybe take down the agenda so we have a bigger screen. Is that okay? I'm just seeing really tiny boxes. That's great. And Patrick, are you good? Should we just open it up for questions? From
Yeah,
the
if you want to open it up
members?
to questions, I can put up our existing results. We've been drafting things along the way, but I don't really have any pretty pictures to show.
That's okay.
So
That's fine. That's great. No, I just wanted to make sure I wasn't going to the full screen if you were going to put up slides. Yeah, so council members, questions for Patrick or Chelsea? Kate.
Just wondering, it's a clarifying question. So you are seeking to link VCures with the vital statistics death data?
I guess so. I think that Chelsea might be able to answer this a little bit better than I can, just because of her understanding of the way that VCures works. My thought is that there might be mortality data within VCures, but and I think Chelsea had corrected me on this previously. I don't know if you have anything to add there, Chelsea.
Yeah, I'll just add that this is not necessarily a request for a new linkage. We do have an existing crosswalk file to link to the vital statistics data, but just a new project that we wanted to bring to the Data Governance Council for approval.
Okay.
Thank you.
And do you have approval from VDH?
We have approval from the original linkage, which was written not necessarily project specific. We can definitely bring the details of this project back to them, though, to make sure that they are okay with continuing the linkage and the usage for this specific project.
I think that would be a good idea just to document that you have their approval. I'm working on memory here, and I might not be right on this, but it's possible. I have to look back on the policy or the approval. Often it's project specific, so it doesn't mean that it wouldn't be approved, of course, but it's just good to document if there's a new project using that linked data file, that you have approval from both entities.
Yeah, definitely. We're happy to reach out to them and make sure we clarify that.
And Kate, just a question for you. If that's the case, would you want that done before we voted on this, or because I know this is
no. Yeah, I would think that if we were to approve this request, it could be approved contingent upon approval, by, it's just that it's a linked data source with another agency's data. And so, did you need IRB approval for this by chance?
So for the original linkage, that linkage was determined by the state to not be human subjects research, which we have for the linkage. And then Patrick has individual UVM IRB approval for the project itself.
Got it. Okay. Yeah.
Hey, this is Josiah. I'm a new guy here. So you're linking to the death registry. Are you also linking to UVM internal sources around the geriatric? No, okay.
No, we're not. It for a lot of reasons, not the least of which being that it becomes a bit challenging to ensure that we have the accurate or that all of our patients are being seen specifically within the health network and not at providers that are outside of the health network. So we wouldn't be linking to those internal sources.
Okay. So can you then, and maybe I just missed it, can you then explain like how linking these two sources is going to support the research that you're doing? Because somehow that didn't click.
So essentially with the VCures data, we have a utilization based off of the claims that were filed for each of the individuals. And right now we're assuming that all of those individuals are receiving or capable of receiving treatment through the entire treatment period. So all of the years of 2016 to 2019. But so if a patient doesn't receive any procedures in 2018 and 2019, we're just assuming that maybe they got better and don't need procedures anymore, not that they actually passed away during 2018 and couldn't receive procedures. So what we need to do is essentially censor the number of procedures for an individual based off of whether or not they're alive. And that's what the death data allows us to do.
Okay, thank you.
Other council members, questions, comments?
Not at this time.
Valerie?
Yeah, thanks. So this is a continuation of something that was already done before.
So we haven't published any of our results because we're under, from our perspective, the results are wrong until they're censored. It would be like saying that essentially it would likely be underreporting because you're assuming, or it would be assuming that patients are receiving fewer treatments than they could actually be receiving. And I think especially because we're looking at studying older Vermonters, that censorship would, really have a pretty substantial impact on what our findings could be.
Sure. But you've had the VCures data before, but you haven't had the death registry
Yes, exactly.
before.
Yep.
Yeah. Okay, thank you.
Oh, I have a quick question, Patrick. So I'm just confused. Is this a study to compare the interventions, like for the Medicare population, people using Medicare versus commercial, or is it not comparison but just private insurance?
It's so in practice, it is that comparison because individuals over the age of 65 are on Medicare. But I would say it's less about the healthcare insurer that an individual has and more about the age of the individual and whether or not there's a difference there. We've discussed including descriptions about coverage for the different procedures within our publication, but from what I recall, the clinician was telling me that the services that we're looking at specifically were largely covered by private insurers and public insurers equally during that time period, or at least they were covered. So we wouldn't have to make that comparison directly.
Thank you.
Okay. Any other questions from the council members? If we have a motion, we can entertain a motion and see if folks are ready to vote. I can move that I move that we approve the request. Do I say link data? This is where folks need to correct me. Looking at Kate, the request to reference the data from the death registry. Kate's going to
I
chime
think
in.
They're requesting a data linkage.
Linkage. Okay.
Yeah, for this specific
Words matter.
project.
Okay.
Yeah.
To link the data as requested.
Yeah, you know what, though, for the minutes, it would be helpful, Patrick, you might have to help us with this, but what would be the name of the project for
Yeah,
which this data linkage is being requested?
Yeah, let me just pull that up really quick, just to have the specific name. Oh, that's not the one.
Okay, I will add to the conditioned upon approval by VDH. I'm writing this down so we can add it to the minutes, Stephen. Need to.
Our study title from our IRB is Utilization of Interventional Pain Treatments in Geriatric Patients.
Okay, I'm going to start again. I move that we approve the linkage of data with VCures to, is it Vital Statistics? Yeah. For their study on utilization of interventional pain treatments in or for geriatric patients, conditioned upon the approval of the Vermont Department of Health. Do I have a second?
Second.
Thank you, Josiah. Any discussion? And I should just put it out there for any public comment before we do take a vote, if there's anyone from the public who wants to comment.
So Patrick, I'm just, oh, sorry, Susan.
I didn't know
Patrick,
where you were coming from, Eric. Yeah, go
yeah,
ahead.
it just appeared. So I keep getting I got turned around. So I understand the linkage for the Medicare to geriatric population.
Mm-hmm.
You mentioned a few times that you're comparing it to younger people, or just comparing things to younger 65 plus persons?
To younger people in general. So our patient population is 18 years and older. So we have the claims data for all patients of that age that have a diagnosis of low back pain during that period and then received a treatment of interventional pain within the year of their diagnosis. So that's our patient population.
So you're censoring to prevent like an undercount in the geriatric population, but it seems to me like you would also need to censor in the under 65 population, right, for folks who move to self-insurance plans, which you can't know from VCures.
Right. So admittedly, that is true. And I think that is really a limitation of the data set. and one of those pieces where we can make assumptions on the rate at which that happens. But ultimately, no claims database would be able to speak to self-paying.
But like, is there a reason that you think, so that's a limitation of the data set, right? But like, there's a difference if you're censoring something for one population and you're correcting it, but you know that's not the correction you need for another population. It's like, why not treat it as just error across the board? Why fix it? If you're expecting potentially not censoring to result in an undercount, why not have an undercount across the board?
Well, because we can, it makes sense to correct for what we can correct for, and then claim as a limitation the things that we can't correct for. I mean, ultimately, if we have estimates for dropout from self-pay, then we can essentially do some randomization and randomly drop individuals out and run that iteratively and kind of, I guess, a Monte Carlo sort of approach, and see what impact that would be. I think based off of the patient population that's receiving interventional pain treatments, it seems relatively unlikely for the self-pay to have as considerable an impact, just because the number of providers that you typically see before you get to interventional pain, based off of referrals, is high enough that I would expect it to be consistent throughout an individual's treatment. But I do think that that's a very valid point, and it's certainly something that we intend on including in our limitations. But naturally, I think we want to remove any possible errors before publishing, even though we can't remove all of the errors.
Great. Thank you, Patrick.
Thanks, Eric.
Eric. Okay, any other public comment? Okay, so all those in favor of approving this request with the condition I stated, say aye.
Aye.
Okay. Any opposed? Okay, so thank you, Chelsea and Patrick, for coming in. We will note to hear from you as soon as you've received approval from VDH. If you work with Ravi on getting that to us, that would be helpful.
Great. Thank you so much.
Okay.
Thank you.
Thank you. Have a nice day.
I know the next agenda item was also, I think, in reference to the data linkage from UVM. Do you need any input on that, or?
I think you're more than welcome to stay. I'll look to Ravi and Stephen and Lindsay if you would like UVM to stay. Read them.
Yeah, I think the request came up, like part of, like UVM's request was included, but, yeah, just like you said, Susan, like if you can stay, that's great, but it is not mandatory.
Oh, I'm happy to.
Okay, that'd be wonderful. Thank you, Chelsea. Okay, so the next item on the agenda is data linkage policy changes. We have a potential vote, so if we're not ready to vote today, we might want to leave it open for public comment. Let's just see how we feel after Lindsay presents to us. So I'll turn it over to you, Lindsay Kill.
Hi, thank you. I'm Lindsay Kill on the A team. I'm the Deputy Director of Data and Analytics. So today I'm just going to go through some data linkage policy proposed changes. We've been thinking about putting this forth for some time and started working on it in earnest couple months ago. And there's just been a lot of different requests and a little bit of confusion about the current language in the data linkage policy. So it's mostly clarifying and making things a little bit easier. So the current language in the data linkage policy defines the data linkage as the merging of two or more unique data sets or files to connect common identifiers across the data sets. That language was a little confusing to researchers, and the data team was getting requests to review data linkages for things that we didn't feel were needed. So we wanted to make this language more specific to what actually needs to be linked in order to create a linked file. So the new addition here is this sentence: GMCB rule 9.501A states that no person outside the board may link VCures or VUDs data, including public use data, with any data source containing personally identifiable information or other data sources that could result in the identification of individuals in the data set without the express written consent of the GMCB. So just further clarifying what we mean by the linkage request. And then again, adding the GMCB rule 9.501A, defining that linkage. And then this additional language here: this policy describes circumstances under which the GMCB may allow the linkage of VCures or VUDs data with the data sources containing personally identifiable information or other data sources that could result in the identification of individuals in the data set. So that's the first proposed change. And then the second one is we contemplated whether or not as it's written right now, any amendment or update needs to be brought back to the Data Governance Council to reconsider additional data linkage. But we wanted to propose that if the data linkage request or amendment is only to add additional years. So the data linkage is the same, the linked variable is the same, the project's the same, but it's only adding additional years of run out from the data, or extend the timeline. Like, let's say the researchers need the same data, but they need it for a little bit longer, that this does not need to be brought back to the Data Governance Council. That we just need to be notified in advance of those changes. So that's what that language is suggesting. And those are the two changes.
Great, thank you, Lindsay. So, has this been posted for public comment? Lindsay, do you know? We have this up on our website. I don't think we've opened up a public comment period, though.
No, do we have?
We
I guess I
don't have
didn't
to.
realize that we had.
No. Sorry,
Oh, okay.
I didn't mean it. It was more of a process question.
Oh, okay.
Yeah, and we'll do public comment here today. So, no, we are not in it. We do not need to post it and have it out for public comment. And but if any council members would like more time or hear more comments, we can do that. It's an option. And then go ahead, Josiah.
I had a question on the second part. The situation I don't want to get into is like basically that things can go in perpetuity without us being able to say, wait, stop, why? So how does this change ensure that like I can't just keep notifying GMCB for the next 100 years, for example?
Which section is it? The policy?
I think he's talking about the one to extend the timeline of the data of the data linkage.
The last one, yep, got it.
Yeah, I think so. I can. Well, I hear that. I will say that before requests, oh, Ravi, do you want to answer? I see your hands up.
Yeah, I think all the data linkage based on the policy and also on the DUA, I think the data linkage requests, like cannot exceed the DUA timeline. So they cannot request in perpetuity, linkage request is based on the DUA. If the DUA, for example, this data linkage request that came from UVM, the DUA expires in April 2026. So the linkage, cannot be beyond to April 30, 2026.
So, okay, I guess what I was wondering was I looked at the agenda from June and there was a data linkage request that went through, I think, 29 from UVM. So I think, and I'm not like, I don't know how all these pieces play together yet. I think in general, yes, I appreciate that the DUA kind of provides a stop. But I guess I'm wondering how we're currently doing things if we already have things that are extending beyond the duration of the DUA.
So I think what I can say is that even if something, so I think what we're trying to do here is make it easier for researchers to make it easier for researchers to add additional years or extend the timeline like for a project, especially if there's no other changes to, I mean, there can't be any other changes according to our data linkage policy. So these would be the only two where the difference is we just wouldn't bring them to the Data Governance Council. The GMCB internally still has a very robust review process with our legal counsel. So it's not that we would get these requests and say, oh yeah, according to the data linkage policy, like renew, there would still be some manual review process, for us on our end, and we ask thoughtful questions of the researchers and all that. It's just the researchers wouldn't have to wait, along the schedule of the Data Governance Council, which is every other month. And sometimes the agendas are pretty full. So sometimes researchers have to wait 2 cycles, or then sometimes more, depending on if a vote is decided on that day. So, yeah. It's still, I guess all that to say, it's still internally reviewed very carefully.
Okay.
And Tom, I'll just maybe sharing out, like Josiah, I hear what you're saying. You're like, this is like, what is our process now? I think Lindsay described it. This is all, like, we have it all in writing. We have, it's a robust internal process, right, Lindsay?
Yeah.
I think I'm glad that we have robust internal process. I think that solves a lot of it. The DUA expiration solves a lot of it. I think what I'm pondering is if there's a way to do something slightly less than open-ended. And I don't know, you can double the original term or something, like, right? Like put some sort of an upper bound on it. But the internal processes may mitigate this. So I'm good for the moment. Go ahead, Tom.
Okay. Thanks, Josiah. Tom.
I think I think questions similar or along the same lines as Josiah, and maybe it's just because we're new. But my question is, if we have data set A and data set B, and we merge them for a project, when the project ends, what happens to the merged data set? Is the link broken after that, or how, in the world that I'm used to, that would be data set A, data set B merged, that becomes my analytic data set for that project. what happens to that analytic data set after the project?
I'm going to try to answer, but Ravi or Steve, can you jump in if I answer wrong? I'm pretty sure that under the DUA, there's like a data destruction timeline that they have to follow. And so they have to, when the project is over, that data needs to be, they need to verify that they've destroyed it and properly.
Okay. Okay. Yeah, I think it'll take me a little bit of time to get up to speed about thinking about data management. It seems easier to become concerned with the methods of a study and critiquing the methods of the study, when I think for data governance, my understanding is that we want to be thinking about where the data lives, who has access to it, the safeguards around it, not so much the methods, the analytic methods the researchers are going to use. And if I'm wrong about that, then we can set me straight as I spend more time here. But we don't have to take up a lot of time today. I'm new and trying to get the lay of the land.
Yeah, Kate, go ahead.
So this may be addressed in that we haven't seen this particular data linkage request, and that may be because it's not a new data linkage, but a new project around a linked data set. So it's a little bit different. But in an application for a data linkage, the entity, they already have a data use agreement. So they already have access to vCures. They're asking to have the data linked with another data source, and they have to get approval from that other data steward. But within the application, they have to describe a process for data destruction upon completion of the project. So they don't have to destroy all of the vCures data that they have, but
I understand.
Related to the project. It doesn't answer the question of when the project request extends beyond the data use agreement, because in our current world, our data use agreements are in 2-year increments, and an entity can, I would say a state agency, not just any entity, but a state agency can request a 2-year extension. So if they were to not be extended, I think then all of the data needs to be destroyed, and that would include a data linkage, previously approved data linkage request, even if that date extended beyond it. Though I will say that's not explicit in the policy, which I'm realizing now between your questions, Tom and Josiah.
Thanks for clarifying.
Thanks, Kate.
So Kate, not clear in the policy that we have in front of us, or like we should have some other stuff added to the policy as part of this package?
Yeah, I guess that's maybe a question for discussion amongst the council members. I'm really just kind of thinking about this in the moment because of these questions, that the language that Lindsay is proposing, I think does clarify and strengthen the policy, and I support it. Your question about if we have a data linkage that was approved through 2029, but a data use agreement that's only approved through 2028, what happens then? So what I'm saying is, I think it's implicit in a data use agreement that is not extended, that all data would be destroyed, even if the data linkage request was approved for a longer date. But if the if any of the council members want to discuss and maybe add in some language to, to kind of specify that's what would happen, or that no data linkage request would be approved beyond the date of the data use agreement, something like that. I think we could entertain that.
Yeah. And just to add to what Kate said, I think the current policy does highlight that the data linkage request, should be, I'll paste it here just for everyone's review. So this is what the current policy states. I don't know if it fully covers it. Oh, chat is turned off, but maybe I can.
Chat is turned off. Sorry.
Yeah, maybe I can share my screen for a quick second if that's okay.
Sure.
Okay. So this is our current data linkage policy. I'm sharing. Please let me know when you see my screen, please.
You see it.
Right. So here is at Kate's point, this bullet point right here states that, it should be limited to the underlying DUA. Right. So further clarification is needed or not, that is up for discussion, but it currently states that it is limited to the DUA.
I guess the question before us is, does that address the concerns of the perpetuity of the linkage?
From my perspective, it does resolve the immediate concerns. I do think that it's something that we can clarify. So I guess my opinion is that I'm with you, that the changes are good and helpful and we should move forward with them. But I think maybe we should have a follow-up, some tweaks in this that just clarify that, because I think that would be tough, trying to put myself in the shoes of like the folks from UVM who were presenting earlier, like, hey, I've got a project and a grant and all the things that go through 29, and then like, oh, whoops, it's done. Now I don't have it anymore. And just making it that clear so that while they still may be blindsided, they won't be quite as blindsided.
I think that makes sense. Do other council members agree? So tweaking language a bit more to clarify that.
Yeah, I wonder, I have a suggestion, and that I wonder what you all might think of this. If the policy has this statement in it and we feel that it's satisfactory, what we could do is make more explicit in the application process. So sort of move it into the operations realm, where in the application, it's just more explicit that, a researcher just needs to understand that they may be requesting the data for the next 5 years, but the linked data set has to adhere to the protections of the data use agreement, which might end sooner. Or something like, or even just to say, like, you can't request data linkage beyond the constraints of your data use agreement, something like that. But we could address it in the application as opposed to more explicitly in the policy, since this is a bulleted item already.
I like that. Could we update the application and then we could share that when we've done that with the council members and others, public? I also like that too, because it's right up front. I mean, there's a lot of policies and information. I think when, who was just saying this, maybe it was Tom, like when you're doing a project, a research project, and then you're not aware that this linked data set could end before you're done. So I like that solution. And then would the council feel, we'll put this up, but would you feel like you could vote on this today, or do you want to see that change in the application first?
I would be comfortable voting today. That's me.
Yeah. You're steeped in this.
Put a lot of faith and trust in the team.
I mean, we could also do a condition too, like conditional upon satisfactory language in the application addressing the time limits on linkage. This is a great discussion. Yeah, thank you. Thank you for everything. You guys are awesome. Do I have a motion at this point?
I'll move to approve the revisions, the revised language to the data linkage policy contingent on addressing time constraints within the data linkage application.
Second.
Thanks, Josiah. Do we have any other discussion from the council members? And I'll open it for public comment as well before we vote. Any public comment on the materials we reviewed and the motion before the council? Okay, seeing none. All those in favor say aye.
Aye.
All those opposed? Okay, the motion passed. Thank you, Lindsay and team.
Yeah, thank you
And
all.
we'll follow up with some proposed language to the council. And we'll post that on our website as well. Great. Okay, I think the next item is just a general public comment. We've taken public comment throughout, but is there any other public comment for today? Okay, hearing none. Do we have any new business from the council to address or the staff to address today? Do I have a motion? Well, before I motion to adjourn, Stephen, when is the next meeting? Do you have that date in front of you? I know we got a little off track over the summer. It was a bit, a lot going on and staff changes, but it's usually every 2 months and we may not have the dates yet for next year. And if we don't, we can send them out. We can follow up.
I don't have the exact date, but it would be the first week of February.
Okay.
It should be February 4th. But yeah, Stephen, it would be good to just check and make sure that there's a recurring meeting on everyone's calendars. Or Kristen, if you're still there, I think actually you might have set up that that meeting recurrence. So that would just be good to double check.
And they're always for our newer members, they're always Tuesday afternoon.
Yeah.
At 2.
Yeah. Every other.
I don't have that one, so
Okay.
with enough of us, it might be worth resending the recurrence.
Yeah. Yeah, we definitely will. We'll send it out for the year. Get ahead of all your busy schedules. So.
Yeah.
Great. Okay. So
Did you say February 4th?
That's where we're, yeah, that's what we were shooting for.
Oh, I don't have it on my calendar either, so I think that the meeting recurrence might have ended with this one in December.
Okay.
But that's the typically over the years, it's been every other month, the first Tuesday, starting at 2.
I apologize. I already know I can't make that.
Oh, okay. Okay, well, and we'll poll if folks, we don't have a quorum, we'll reschedule. Thanks, Lowry. Okay, and do I have a motion to adjourn?
So moved.
So moved.
All those in favor? Aye.
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 Great
Thanks,
meeting.
everyone.
Thank you all. Great job, Stephen and team.
Thank you,
Welcome,
everyone.
new members. Take care.